7-day average of new COVID cases is rising, and more cases are being linked to the COVID variants that are more contagious than the original strain.
There are 5 variants, and all of them have been found in the state. This has health leaders concerned about stopping another potential COVID wave. Amanda Quintana is live at the Alliant Energy Center tonight with what this means that you should do. Amanda?
Yes, well, if you've already been vaccinated, you should feel confident that you are protected from these variants. But the main concern with all of these rising case numbers is that means there's more opportunity for people who are not vaccinated to come in contact with those strains.
You're exposed to, at a certain distance and a certain amount in the old strain, and then maybe your body would be able to not be infected. With B117, you're more likely to be infected with that.
There are 5 COVID variants out there that need less interaction to infect someone, making it easier to get the virus.
All 5 of these strains are currently in Wisconsin, and the proportion of the Wisconsin infections that's caused by the variants of concerns is growing week by week.
Our case count is rising, giving the variants more opportunity to infect people. In Dane County, we've seen a more than 35% increase in cases over the last 2 weeks. Even though almost half of the county's population is vaccinated, that means more than half of people can still get and spread the variants, including kids who can't get vaccinated yet.
Where you're seeing more variant spread, we're hearing anecdotally more stories about younger, healthier people being hospitalized and younger transmission.
The best way to protect the unvaccinated is to stop the spread by wearing a mask and social distancing. That can stop the state's increase that's starting to look like another wave.
What we don't know yet is whether that's going to translate into increased hospitalizations, severe illness, deaths, and so on and so forth. So does our vaccination status and the progress that we've made thus far protect us from that?
With almost 80% of Wisconsinites 65 and older vaccinated, the hope is that wave would be less deadly than once before.
If you're 16 and older, the advice is to be persistent and find a vaccine. As for kids, Pfizer asked the FDA today to allow their vaccine to go to kids that are 12 to 15 years old. So that approval could come in the next few months. And as for kids younger than that, it could take much longer. Maybe by the end of the year, they'll be able to get a vaccine. So for those kids, the best way to protect them is to wear a mask and socially distance.